This is Bob Byrnes, Mayor of the City of Marshall. Once again, we're here to give an update on the current situation with the COVID-19 coronavirus. With me is Dr. Steve Meister. As we know, he's Chief Medical Officer at Avera Marshall, also a member of Marshall City Council, along with Scott Monson, Superintendent of Marshall Public Schools. Today we're going to give an update on the governor's order and how it has implications in the City of Marshall, what that means. Steve will give a medical update, and Scott will give an update on the distance learning that will go into place next week. As we all know, earlier this week, the governor did issue a stay-at-home order that does go into effect tonight, and I should say today is Friday, March 27th. We're recording this at about 2:45 p.m. So the governor's stay-at-home order does go into place tonight at midnight. Will stay in effect, unless it's extended, will stay in effect for 2 weeks. What this means is that people who really do need to stay home, you can leave your homes for certain things, such as exercise or walking pets or going to the grocery store or doing other essential things. We do have a number of businesses that are essential businesses that will be open. We have other businesses that are providing things that people need, such as a number of our restaurants do have curbside takeout ability, so you can order ahead, pick it up, and of course we have food delivery services. Our grocery stores are open, gas stations are open, and some other essential businesses. I'll come back with some other details about the governor's order, but Steve, let me turn to you and talk about the medical situation today.
Thank you, Bob. So the medical situation is, for right now, about where we were the last time we spoke. Unfortunately, with the governor's speech, he also gave some of the hardline numbers of what is expected with this virus. And I don't mean to scare people, but it is real. You know, let's talk about the facts of this virus. 80% of the people who have this virus will have the common cold. Many of those people may not even have any symptoms. However, they will be actively shedding the virus. But of the people that do acquire this, there will be 15% who become very ill and 5% who become very, very ill, needing hospitalization and potentially ICU beds. And the fact of the matter is that if you do the numbers like the governor did with Minnesota's population, the number who need ICU beds outstrips the number of ICUs that we have in the state. So flattening out the curve so we don't get that huge bubble will help preserve the beds that we have. We're not going to eradicate this virus. It has to burn itself out over time, and that will take a lot of time. Nobody really knows. It's a novel virus. But to be sure, just like what Mayor Byrnes said, staying at home unless you need to go outside, and if you do go outside, please practice social distancing. Washing your hands, really good, 20 seconds. Sing a little song while you're washing your hands. Make sure it's 20 seconds. Try not to touch your face. Maintain the social distancing. You know, the last video that we had was kind of a test, and we didn't do the social distancing. Now we are. It's important. We need to keep people safe and keep people as safe as they can be. So please maintain the social distancing, take care of yourself, exercise, eat right, eat well, and be kind to one another.
And Scott, the distance learning?
Yeah, as part of, in addition to the stay-at-home information that the governor announced on Wednesday, he also said that schools will remain closed until May 5th, and then I think he will reevaluate at that time. We knew that was coming. We anticipated that anyways, and our staff have been working really, really hard on distance learning plans for our students. We've had staff calling families to check on their internet and technology capabilities. Technology won't be ultimately the only thing that will be involved in distance learning. There will be other things and that won't involve taped lessons or needing to do work on a laptop or iPad or whatever, but technology is definitely going to be important. So we've been reaching families, trying to find out how many of those families maybe need internet. We do have some options and ideas for families. We want to work with you if you don't have internet. So please call the district office at 507-537-6924. We're excited and a little bit nervous about the distance learning starting on Monday. It's new for us. Even though we've had e-learning, it's just a different way of doing things. And we're going to try to really ease into it, slowly reconnect with the kids. I know our staff are super excited about seeing kids' faces again and having the opportunity to talk with them. So we're going to reconnect with kids, make sure that technology-wise and support-wise they're getting what they need, and then we'll ease our way into the lessons. In addition, as we've been doing since March 18th, we'll continue to provide child care services for children ages 4 through 12 of emergency personnel at Parkside between 7:30 a.m. and 5:30 p.m. And we will continue to prepare and distribute the grab-and-go bags or meals with 1 breakfast, 1 lunch, and a snack between 11 o'clock in the morning and 2 o'clock in the afternoon at the 4 different locations that we've been using. If anything changes on that, we'll reach out with social media. But we're excited about Monday and getting going on this and reconnecting with everybody, and just continue to please watch social media. I'll be reaching out to our families and staff as well over the weekend, and if there's anything we can do, let us know.
Thank you, Scott. As we have said in the past, the things will change. Tomorrow will probably be different than today, but this is our plan as of today. The City of Marshall continues to operate under our emergency operations plan. That means that all the essential services that people need in terms of electricity and water and wastewater and public safety and fire protection and police protection and emergency management, all of those and others, those services will continue. I mentioned earlier we have a number of businesses that will continue to be open. Many of those have changed their hours. Included in that is the city operations of Tallgrass Liquor, which starting on Monday will have reduced hours from 10 in the morning until 8 o'clock at night on the Monday through Saturday, and their Sunday hours starting next week will be noon to 5. And that, as well as other businesses that have changed their hours, is all with the need to allow the staff to restock and accept deliveries and do sanitation so that they don't interact with the customers while they're doing all of that. There'll be many questions, and so we do have on the screen the health-related questions for Vera, the city-related questions for the City of Marshall, the school-related questions, of course, for Marshall Public Schools. And if anyone has questions, feel free to reach out. This is Bob Byrnes, Mayor of the City of Marshall.